June is CPR and AED Awareness Month. Cardiopulmonary resuscitation, also known as CPR, is a way to save the life of someone who's in cardiac arrest, or when someone's heart is no longer able to pump blood on its own. This is by attempting to restart their heart. It's a simple technique that anyone can learn. A person of any age needs CPR if they aren't breathing, they don't respond, they collapse, and don't have a pulse. Prior to performing CPR, make sure to follow these key steps. Ask the person if they're okay. If you know the person's name, shout their name and see if you get a response. Then dial 911. The dispatcher can guide you through the steps to take until paramedics arrive. Quickly ask someone nearby to get an automated external defibrillator, also known as an AED, if one is available. Tilt the person's head back while they're lying on their back, and check to see if the person is breathing or not to see if their chest is going up and down. Check for a pulse by feeling the side of the neck or wrist, and start performing CPR if you don't feel a pulse at all. Follow these steps on how to perform CPR. Step 1. If the person isn't breathing, put one of your hands over the other and place them in the middle of the person's chest. Step 2. Putting the force of your body weight behind it, push your hands down hard in the middle of the person's chest. Use the heel of your hand or the part just before your wrist. Try to keep your arms straight. Step 3. Continue to keep pushing on the person's chest. This is also known as compressions. 100 to 100 times per minute, pushing down 2 inches each time. Make sure you allow their chest to come all the way back up between compressions. For every 30 compressions, or about every 20 seconds or so, give the person 2 mouth-to-mouth rescue breaths, and keep doing chest compressions and giving rescue breaths in a cycle until the person revives or more help arrives. So how do you perform a rescue breath? First, pinch the person's nose closed while tilting their head back a little with their chin up. Close your mouth over theirs and blow a deep, firm breath until their chest goes up. If the person's chest does not come up, check to see if there's something in their mouth. Give a total of 2 breaths and go back to doing compressions. If you're performing CPR on a child or baby, please refer to the following steps. Performing CPR on a larger child, you would be using the same steps if you were performing CPR on an adult. For a smaller child, you would be using a one-handed CPR technique. And for a baby, you would be using your thumbs placed side by side on the center of the baby's chest just below the nipple line. If you're not comfortable performing rescue breaths, even hands only or giving just compressions can help a person stay alive until first responders arrive. CPR increases a person's chance of surviving cardiac arrest, but it's important to act quickly. Make sure to take a class or get certified if you already have not. Organizations such as the American Red Cross have CPR classes that you can take in person or online. Thank you for taking the time to watch our educational video on how to perform CPR. If you or a loved one needs any medical attention for non-life-threatening emergencies, please visit any of our Mark Urgent Care facilities by going to our website at www.markmedical.com to schedule a reservation or simply just walk in. We are here for you and your family 7 days a week. We also offer virtual visits.